This little series of videos is for all the mothers out there, the potential mothers to be, and just thinking about, I love being a mum, but there are changes that occur within our body, and I'm going to concentrate on some of those things that occur within our skin. First of all, we're going to get into pregnancy, and there is one condition for me that stands out a lot because there is something you can actively do about it that can make a big difference to your skin for the rest of your life. And this happens quite often in pregnancy. That condition is melasma, or cloasma, it sometimes gets called, and it's the mask of pregnancy. What it is increased pigmentation, and it's usually on the face. It can often be along this area, it can be along the jawline. In fact, I had this in my first pregnancy along the jawline because I hadn't read the paper, which I'm about to tell you about, and it's really common. In some parts of the world, it is as common as 60% of people who are pregnant will have melasma. Here, it's less than that. It's about 20 to 30%. What happens is you have estrogen, progesterone, and something called melanocyte-stimulating hormone. Melanocyte-stimulating hormone does what it says on the tin, and it stimulates melanocytes, those pigment-producing cells, to produce pigment. And they produce it at an abnormal rate. And then the pigment gets stuck in the skin and you see it as these brown patches that appear. Now, what happens after pregnancy is still a problem because those melanocytes, they are already stimulated, and they're not cells that kind of die off quickly. They hang around for a long time, and hanging around for a long time means that you're going to have that pigment then continually being made when it's exposed to even small amounts of ultraviolet radiation. So what can you do about it? Well, this is a really exciting thing because there was a study that came out in 2007, which I should have read because I had my first baby in 2009. But in 2007, it showed that by wearing a high factor SPF, you can reduce your risk of developing melasma, which doesn't just affect you at that time of pregnancy, but actually protects you then for the future as well. In this particular study, they had 50% of the population were developing melasma within their pregnancy, and they give them a high SPF with a high UVA in it, and they asked them to apply it every single day. And they dropped the percentage from 50, it was 50.3 actually, down to 2.7%. It's a huge decrease in melasma developing. But the thing about it is, it also is melasma developing then forever, because a third of people who develop melasma in their pregnancy will be stuck with it forever. And so I think making that small change to the skin on your face, especially if you have family history of melasma, might be the thing to save you. If you're pregnant, please put on your SPF.